Okay, so welcome everybody, to the this session where we're focusing more on the issues around aging without children and care and support. I met with Jean, who is part of the Leeds AWOC group, and we had a good chat. And she is someone who is aging without children, and we felt the session really needed to, her fear and the fear of others from her AWOC group was who's going to speak up for me when I need care and support. So that's where we wanted to start, really. So Joe, if you're okay to go to the next slide, you're very good at multitasking. So a little bit of, we're not doing intros, of course, but a little bit about us, about who's on the session and what we're going to be talking about. So I'm Helen, I'm from Community Catalysts. We're a community interest company. I'll talk a little bit about us in a little while. Oh, Jean's muted apparently. Joe, if you're able to unmute her. I'm glad I'm not in your chair. So we've got Jean, who, who's going to share her story, her own personal story, and a little bit of being a member of a local AWOC group, and what some of the real fears are. Jennie's here with us as well, who is making some notes for us, but is also an AWOC trustee, and we can absolutely draw on her expertise. Liz Jones, I'm hoping, is here from the National Care Forum, and she's very much going to be talking a little bit about what Kirsty mentioned earlier.
I've just arrived.
Hello. Oh, hello, Liz. She's here. That's good. Hello, Liz. About the toolkit for providers in terms of how providers can be more AWOC confident. And then we've got Professor Jerry Chu, who I've seen. I can't see him now, but I know he's here, and he's going to talk a little bit about family and group conferencing and how they've adapted to be more AWOC competent and confident. So is Jean here? Is she unmuted?
I'm just looking, but I can't see her in the room under the name Jean.
That's very odd. She was definitely here earlier.
Yeah, and she just said to me, I can see myself on screen, but I'm muted. I wonder if she's gone into the wrong... I don't think she's gone into the wrong room.
Well, Jean, if you're here, if you could raise your hand, use the raise hand function, that will highlight me to where you are as well. Oh, I can see her, and I'm asking her to mute.
If you can go to the next slide, Joe, that would be great. Jean, are you here?
I'm here.
Hey, thank goodness for that. Over to you, Jean. Just a little bit about you, your fears, your thoughts would be brilliant. Thanks, Jean.
Good afternoon, everybody. I'm Jean Basson. I'm aging without children. I'm in my mid-70s, and I'm aging without children. In fact, I'm aging without any personal family support, which is pretty difficult as you're aging, but very easy on Christmas presents. I've been involved with aging without children in Leeds since 2014. I think Kirsty said right at the beginning of the sessions that she started that in 2014, and I was involved with her. I'd seen her article in The Guardian. I contacted her. She very kindly came up to Leeds, and myself and some colleagues from York met up with her, and she described her vision for local groups on aging without children. That's where it all started for us. At a personal level, because I didn't know anybody in my similar circumstances, it was personally very supportive for me and very positive. It was also useful as a first step in starting to arrange to meet with people who are in similar situations, and it was a learning curve in terms of understanding what was going on for older people. My background's in education, it's not in older people's services, so it was very useful. Very briefly, because we have so little time, I'll just tell you a little bit about AWOC Leeds. There are now 9 groups across nationally, local groups, but ours have been since 2014 along with York. We've got approximately 90 people on our contact list and our Facebook page. People are a whole range of situations. It's not an entirely homogeneous group. Childless by choice, circumstance, estranged, predeceased children, children who have their own health, mental and physical health problems who can't support. Some of us have extended families, siblings, nephews and nieces and friends. Some of us have no support systems like that. Many of us, I think it was important for me this bit, have been carers. And I was a principal carer for my mother till 5 years ago. And so well aware of the demands that caring for somebody in later life make and how to do that. And I think that light bulb moment that Kirsty mentioned at the start was where this all started for me. I honestly don't think before I was in my mid-60s that it really crossed my mind. Once I had to be a carer, I understood exactly what was needed, and the fear and became a reality for me. What we do in a positive sense is in the local group, we have four key things that we do in AWOC Leeds. And we have information sessions, which are about things like wills, power of attorney, hospital discharge, independent living. We manage, because we have no funding, we manage to persuade local providers, solicitors, all sorts of other groups to come and talk to us. We've never had any problem getting somebody to come and talk to us. It's been great, really. We meet, God bless them, in John Lewis Community Hub, which costs us nothing, in the middle of Leeds. That we do that sort of thing, that sort of group, about 2 or 3 times a year. Because we can't provide personal direct support, there are 6 of us in the steering group, and we can't provide direct support. We do a lot of networking with our other local groups and agencies across Leeds. We're very lucky in Leeds. We have 37 neighbourhood network schemes for older people, which provide an enormous amount of support across the city. And we get involved with them. We get involved with people like Methodist Homes Association, who also provide support. And we link wherever we can in terms of raising their awareness, in terms of their policies and their practice. We organise social groups on a regular basis. We have regular meetups where people can get together, meet informally, and talk about things that concern them, but also have a general chat where they don't have to talk about somebody's grandchildren, and they don't have to look at the endless photographs of them on phone. People really value being with people who are in similar circumstances, and some of our members feel very marginalised, and that's in a society where it's predicated on families, that leaves them at particular times in the year feeling very isolated. So we do try and provide informal sessions, meet up, coffee, chat, etc. at those important ones. The key one isn't Christmas or New Year, it's the bit in between. So we always provide something in the week between Christmas and New Year. We have a Facebook page which we post information on and receive comments, and we have a website. So that's roughly how it works. I will put on the chat, if anybody actually wants to, is thinking that they might set up a local group in their area, the groups that currently exist across the country are in York, Bradford, Lincolnshire, East Kent, Dorset, Hastings, Gloucestershire. I think there's still one in Middlesbrough. So that's really where, if you haven't got one in your area and you're really contemplating, thinking it might be a good idea, I'll put the AWOC link on, and you need to contact AWOC nationally to start to set up one.
Would you talk a little bit about the fears of getting older and needing care and what have you, yourself and some of the members? That'd be great.
I'm just going to do that.
Sorry.
There've been lots of issues over the years that have arisen with members since I started being involved with this. But my feeling is that underpinning it all, the chief concern and the chief fear is about advocacy. And this has come up over and over again during the day. And we're not talking about formal advocacy. There are systems for formal advocacy. We're talking about the informal day-to-day decisions like healthcare, access to services, sorting out care packages, managing carers, finance, navigating health, etc. Choosing a care home, all that kind of thing, that really day-to-day nitty-gritty. We do encourage our members to ensure that they try and set up power of attorney. It is very difficult for some because they do not have the capacity to have younger members of their family who can take on that responsibility. And I know that our colleagues in East Kent at the moment, AWOC in East Kent, are looking into the possibility of creating a national organisation that be locally delivered that could help with that that gap in the system. However, obviously the things that I've said, power of attorney is an important one, and I know that will come back to that at some point, but it's a huge responsibility and very difficult. The concerns that I've mentioned so far are concerns that fit with lots of older people, irrespective of whether they have family or non-family support. I think for us it's a double whammy in a climate where social care and health is in crisis, and where those services which those of us who haven't got immediate family support need to turn, and where the assumption both at national level, policy level, and at practice is that everyone has a next of kin, and that everyone has a family member to support them and negotiate on their behalf. And patently, from what you've heard all day today, that is just not the case for those of us who are aging without children.
Mm. Brilliant. Thank you. Thanks, Jean. Can we go to the next slide? Brilliant. So we heard some of the fears there, and obviously, you know, in the chat about the power of attorney is a huge fear. But are you aging without children here today, or you know of people? What are your what additional fears would you have in terms of getting older and coming into the world of perhaps needing some care and support to help you to get a good life? Is there anybody else who's got any additional kind of fears that they'd want to add to that? I think that the power of attorney is a huge one. And Jennie just mentioned something there about in East Kent, looking at some different ways. Penny, I think you're there as well, which is obviously a massive issue for people. And can we also come to the next point? What comes to mind when you, and actually the general public, think of, if you're thinking of your care options, what would you say most people think of? What would spring to mind in terms of care when we ask people, when you get older, what is it that you're gonna, what are the choices, what's the general menu of options around care currently? If people would pop some bits in the chat, more family group conference in there, yeah. Care homes, yeah, definitely. I think that's the main one, isn't it? That people think that's the where we're directed to if we're going to need some care and support, is care homes, home visitor, I guess, domiciliary care and what have you. Jacqueline, social worker, think about the future and the current state of social care, and it is scary, absolutely. The purse strings are getting tighter. And end of life doula, we have it. Yeah, I'll talk about an end of life doula. Care homes, care at home, living carer, or family to look after you, extra care maybe. So I guess these are the current options that people think of, and they're a very, very small menu of choice, when actually there's a massive for choice and control. But we talk about choice so easily, but actually people don't have information around what other options may be available. Joe, if we're okay to go to the next slide. But the biggest fear, I think, for people who are aging without children is it's real. 25% of people who are aging without children are more likely to end up in a care home, and earlier as well. And I think, Jennie, did you have anything you wanted to add to that? I know when we spoke, that was something that was really
can you hear me?
Important. Yeah.
Well, I think a lot of this came up for us during COVID when we did a couple of surveys around people's fears. People who were aging without children identified as being AWOC, self-identified, and the impact of COVID on those people. And we did a survey, a local one in York, and I wrote a report on that. And then we did a bigger one. And this came up as a major issue. And it was obviously also a lot of people who didn't perhaps know much about care homes previously, you know, saw the media coverage of families visiting outside care home windows. You know, that was the limit of the coverage. It focused very much on family separation, but of course there would be a lot of people in the care home who had no family, and that's why they're there in the first place. So and also obviously COVID highlighted real big fears around the state of care homes. Yes. And the fact that somebody might end up there you know, moving having to move unwillingly, or not having the advocacy or support to make a choice around any of that.
Yeah, thanks, Jenny. So we know that the view of care is pretty limited, and I just wanted to share some examples of other types of care that are available. If next slide, please, Joe. So some more options around small, tailored, personalised, which is, you know, a fantastic opportunity for everybody, but definitely for people who are aging without children. In the last group, we talked about intersectionality, and again, to have some creative niche supports built around the person are so key. So some options that are around at the minute: personal assistance. So that's where somebody can directly employ somebody to care for them, to support them. Generally, it is done through councils. There's a lot of push around direct payments and being able to employ a personal assistant, but there's no reason why somebody who was perhaps funding their own care and support could do the same. Now, community catalyst, this is the area that where we come in. Up and down the country, we're supporting community micro enterprises, and these are local people who want to use their talents, their gifts, their knowledge of their local community to help other local people in those areas. We help them to start up and keep running those enterprises, making sure that they're legal, safe, sustainable. And the plethora of stuff that they can provide is wonderful. And I think just answering some of the fears that have come up there, some of it is around that practical help that people are talking about in terms of managing the home. We have little sole traders who absolutely set up to do that. We've got to broaden this view that care isn't just about personal care. So we've got lots of entrepreneurs that can provide that. People that are doing amazing things in the community, but it's the essence is really small. They don't have to be employed like a personal assistant, really easy to access. And I've just got a very quick video of Dawn, Joe, if you're all right to lots of micro providers in Somerset yet, but up and down the country, there are lots and lots of more very, very small enterprises setting up to help people. So this is Dawn in Wrexham, who helps Seema to live her good life. Hoping that, can't hear it, Joe.
Are you not able to hear the video?
No.
Okay.
We can see it, but we can't hear it.
Okay, bear with me 1 sec.
Don't worry. If not, we will just let people watch that in their own time. It's a beautiful video. Dawn, who supports Seema, and the relationship is the key that gels them. Dawn probably doesn't see herself as a community micro enterprise, but actually, you know, she's a local person living in Wrexham. Seema needed some support, and they were connected actually through a website that we have called Small Good Stuff. Any luck, Joe?
I think I might fix it. Let's try.
Oh, well done.
It's not work when I come here, really.
Yeah.
It's good fun, isn't it? It's just coming to see a friend.
I've got MS, so my hands don't work so well now. She's able to help me do simple things, even like if we're going shopping, paying for stuff, holding a bag, putting money back in my purse, you know, that sort of thing. Dawn helps me every Thursday to do some wheelchair exercising.
I enjoy coming to see her, tell her about all the things that have gone wrong in my day. I enjoy making, well, little things. I'd say I'm her spare pair of hands.
And I'm a therapist.
So that's just one little enterprise that we've supported. Now we know that the biggest factor, and actually when Jean and I first spoke, we have run a program to develop enterprises in Leeds, which is where Jean lives. We linked with the NNS, the neighbourhood networks. Jean had never heard of a micro enterprise. I'd never heard of AWOC. So I think, you know, we know that information is the key. We're trying to do our bit. We have a website called Small Good Stuff, and that features lots and lots of enterprises up and down the country. You can put a search in. Now, that is only one platform that is around. There's many, many platforms where people can go and have a look. Now, just some other models of care and support that perhaps people don't know about. So there's shared lives, and shared life supporters can support a wide range of people in many, many ways. Generally, they're supported through it's councils that run them. And about over 12,000 people are using them. In 2020, that's the only stat I could find, 10% of older people were using them. So it can be used in lots of ways. It can be where people move into the home of a shared lives carer, ordinary homes, ordinary communities, a short break, maybe a weekend, or a couple of hours during the day. And the carers are checked, verified by the scheme. Like I say, many of them are council run, some of them are independent. And it's about sharing that carer's home, their family life, their community. They provide the care for people. Those shared lives carers are paid a fixed fee, but we know that, again, people just don't know enough about them. With independent schemes, self-funders can buy from them directly. There are some opportunities with councils as well. And then there is also home share, which again is a lovely example built on reciprocity, enabling two people to share a home for mutual benefit. So generally, older person living in their own home has room to spare, has a bedroom, has room to spare, and they'll be carefully matched with usually a younger person called a home sharer, who provide an agreed amount of support in exchange for good accommodation. There's less of these about. There is, sorry, I'm struggling to read the chat as well. But there are some in London, Cambridge, Hertfordshire, Oxfordshire. Again, Leeds, Jean, have you heard of home share? It's another opportunity. You have? Oh, that's good.
Yeah.
Gloucestershire, Mendip, and Swansea. So, we know that there are some other types of care and support out there, but we've got to get people to really understand it. So the next slide.
It's not work.
Oh, we've got Dawn back. Again, how do we make the choice real for people? How do we really get people, including people who are aging without children? How do we make sure that everyone knows about the big stuff and the small stuff? And I think that's what we're absolutely trying to do with TLAP, with Social Care Future, so that when you're thinking about your care options, you're not just going through the yellow door. You've got a range of doors to go through. And we want to now move to how can the practice of small and big be more AWOC competent and confident? And I'm going to bring Liz in now, Liz Jones from the National Care Forum, who is going to share about her work. So over to you, Liz.
Hi folks, nice to see you. Sorry I couldn't join you earlier, but I'm really delighted to be supporting these sessions because I first discovered Kirsty and Aging Without Children when I was working at Methodist Homes, and I was running their policy and research service, and that was back in 2014. And it struck me as such an enormous issue, and I hadn't heard anyone really talking about this as a policy conundrum, both kind of for national policy making and thinking about how we're going to respond to this increasing cohort of people who are getting older and would class themselves as aging without children, as well as thinking about it for individual organisations that provide care and support. So at the National Care Forum, I'm the policy director, and we're a membership organisation for not-for-profit providers of care and support services. So that's quite a wide range of different types of services, kind of more traditional older people services, I guess. So think about care homes, extra care, home care, and then lots of organisations who provide support for people with a learning disability or autistic people or people with enduring mental health problems. And it's also worth mentioning, of course, that when you look at the demographics around people who are aging without children, we need to think also about those people of working age currently who are living much longer than they would have done previously and may well also be AWOC. So a couple of years ago, we commissioned Kirsty to support us at the National Care Forum to develop a toolkit specifically to think about how organisations could properly support people who are ageing without children. I don't know if the link will work, but we worked with Kirsty and a range of our members who delivered extra care, home care, and housing with care and care homes to kind of define what we thought an AWOC confident organisation might look like. And I'm just going to put it in the chat if it will work. Oh, brilliant. Excellent. So if we scroll down to page 5, this is really one of the key things that kind of working group with Kirsty developed. And our idea really from members was that they as organisations were quite passionate about making sure they were inclusive, and they had understood the changing needs of people who were coming to them for care and support. And that includes, obviously, we're seeing a much greater level of acuity and frailty. But as the stats show, people who are ageing without children often end up in receipt of care and support at an earlier age. And there's quite a big overlap between the group of people who are ageing without children and some of our more diverse communities, thinking about the LGBT population, for example. And so people had kind of done thinking about different bits of their strategies to support people, but we didn't really have anything concrete for really understanding what the context for people ageing without children look like, and being clear about some of those things you've already discussed. So making sure that organisations really understand all the different life circumstances in which people might find themselves ageing without children, and bring understanding and empathy and not judgment and not assumption. Also that that sense of inclusivity really matters. So, when you've got care services that might be focusing on Christmas or Mother's Day or Grandparents' Day, or things to create activities, there's always, across all the branding and the kind of marketing, there's often pictures of older people with their grandchildren. There's a whole load of kind of bias and assumptions that fit, sometimes in an unconscious way, into how providers describe their services and the way that they think about the people that they're going to support. So we thought that having some really key principles about being understood, about being included, and more importantly than both of those, I think, actually thinking about some of the practical ways in which service providers needed to look at what they offered in their services, some of the things that have come up today around advocacy, being clear with people, how they're going to be supported, who is going to be that voice for them, who is going to help support them to think about the different things that might need to be put in place legally, but also I guess understanding their ambitions, understanding their history, and making sure that their organisation has done this kind of top to bottom. So we came up with a definition of an AWOC, confident organisation, which we thought would help providers understand kind of where they needed to get to. And then the rest of the toolkit really kind of offers some very practical pointers across a range of areas when providers are thinking about how they design their information, the language they use, even the assessment process that they might use to talk to somebody about their care and support needs, not making assumptions about some of the things that go into those forms, understanding properly how to I guess, gather the full picture of somebody's care and support needs, but also their hopes and fears. We've just talked quite candidly about some of those. And whether you're thinking about accommodation-based services like care homes or extra care housing, or whether you're thinking about home care, it's really important to have a proper picture of the person you're supporting, what they're hoping to get from that care and support, what they definitely need, what they would also like to have, what would make their day a great day every day. And then there's the practical stuff about designing your service so it's responsive, and training your staff so that they actually understand this issue. So having had several iterations of the toolkit, which we developed, interestingly, we developed it during COVID. So we had a lot of online conversations, but we also road tested it with some volunteer members and finessed it and tweaked it. We issued it and we've been promoting it across our membership. We had a workshop session actually last year at our managers conference where Kirsty took people through the toolkit and kind of helped them to understand what the practical things in the checklist. So towards the end of the document, there's a series of checklists to just ask yourselves the question, if you're a manager of a service or you're the leader of a service, you know, have I thought about this from the perspective of somebody who's aging without children? And when I was chatting to Jean, I think it was Jean, said she'd seen it and actually had found it useful. So that really delighted me, because we've been trying to get it out there and just provide a sensible way for people to really understand the issue, because at the beginning there is the policy context and the demographics and all the statistics you'll have seen already. But wanted to find a way to get it out there and then offer some practical top tips. So also, if you're looking at it and you read it after this session and you feel there are things that we should potentially add, then let us know. We're always open to making it better.
Brilliant. Thanks, Liz. And I'm just going to bring Jerry in now from Family and Group Conference A, in terms of how you've made some changes, Jerry, from your side.
Okay, as we've got rather limited time, and
Yes.
This is something that people may not know a lot about. I popped into the chat at completely the wrong time earlier on some links that people can follow. I'm going to pop it back in again now. So if you're interested in what I'm going to be talking about, then follow these up and you'll get a lot more information. So basically, what I'm talking about is an approach to enabling people to make decisions and plans with the people that matter to them. This originated in relation to, believe it or not, Maori children, and it's gradually moved globally and moved from children's concerns around children to being a way of supporting adults, people with mental health difficulties, to make good decisions with people around them who will support them. What it's now still not very widespread, and if people like the idea and think it's good, then please lobby whoever you would like to lobby to say, can this be available to more people? Basically, what it consists of is, as an independent coordinator works with the person to identify who matters to you, who can we get around, and where this has been developed in relation to supporting adults, increasingly it's been found that quite often the people that matter aren't family, aren't children. And what we've done in children, it's still called family group conferencing. We discovered really this is going to put people off, it's giving people the wrong impression. So we've sneaked in the word "and," so we're calling it family and group conferencing. So it's whoever matters, and it may be a combination of members of family, it may be other people that matter. Where I think it's particularly relevant to adults without children is, in many situations, people know quite a lot of people locally or online, or have a community of people they know, but they think, I couldn't possibly ask so-and-so to help me with this because I just couldn't ask them. And one of the things that works incredibly badly in terms of care and support is the idea of a singular carer, which was invented in the 1990s as the way that everything was done. And if one person carries a huge responsibility, then it's not good for them, it's not good for the relationship, it's not good for anything. What can work so much better is having a group of people who get to know each other, who support each other, who have fun together, who do things and so on. And it's much more like the sort of thing you saw on the video earlier with Dawn saying, actually, it's a great laugh, I'm really enjoying this, and it's mutual, and we get something out of it.
I think we're going to be chucked out now. I'm really sorry. We've got lots of questions in the chat.
If you can cut and paste the links I've put in the chat, there's lots more information there for you to find out about it, and it'd be great if people wanted to follow that up.